The following is the executive summary related to the literature review of implications of magnet designation by Stephanie Hartsock. The organization I work for is currently seeking magnet designation. In an effort to meet requirements for the organization is requiring nurses hired after 2012 to obtain their Bachelor's in Science of Nursing or BSN. This has resulted in dissatisfaction among the nursing workforce. Many nurses are not interested in returning to school and may consider leaving the organization. My organization may need to be prepared to lose experienced nurses if they continue to pursue magnet designation. The purpose of this literature review was to examine the current body of research to determine if the benefits of magnet designation outweigh the dissatisfaction among nurses who may have to further their education to remain employed within my organization. The discussion will include the effect magnet designation has on the nursing workforce, patient outcomes, and the financial impact on the organization. Magnet designation is very costly and time-consuming to obtain. Healthcare organizations must meet a number of requirements to be considered for magnet designation. One of these requirements is to increase the number of nurses who have a BSN degree or higher and to increase the number of nurses with professional certification. Changing the policy related to education level may cause dissatisfaction among the nursing workforce. Healthcare organizations must look at the benefits of magnet designation and determine if they outweigh the dissatisfaction that magnet designation may cause throughout the workforce. As I was preparing to conduct my literature review, I plan to investigate the effects magnet designation has on the nursing workforce and patient outcomes. However, as I conducted my search, I found a third theme: financial implications. The following slides will describe the implications magnet designation has on the nursing workforce, patient outcomes, and financial impact for magnet-designated organizations. Magnet designation has the potential to have a major impact on the nursing workforce within magnet-designated organizations. Magnet-designated organizations have strong staff development programs in place and encourage professional development. As a result, these organizations have higher rate of nurses with a BSN or higher and an increased number of nurses with a professional certification. In addition, nurses who work for magnet organizations felt empowered to collaborate with interdisciplinary teams and to implement evidence-based care. This level of empowerment increased overall job satisfaction among nurses with higher education and professional certifications. Magnet-designated organizations employ more nurses with a BSN and professional certification. As a result, patients receive better care and experience improved outcomes. Literature suggests that nurses with a higher education and certifications recognize complications more rapidly and are able to decrease mortality rates in post-operative and trauma patients. Studies also demonstrated that nurses with a BSN or higher are more effective in reducing fall rates within their organizations. In addition, nurses with additional education and certifications tend to have improved communication skills, which increase patient satisfaction. Increased satisfaction rates and patient outcomes has a direct impact on improving reimbursement rates. In an effort to improve reimbursement, healthcare organizations should consider magnet designation as a way to ensure nursing excellence and improved patient outcomes. Additionally, magnet-designated organizations have a higher job satisfaction. This helps decrease the level of nurse turnover and saves the organization on the cost of orientation for new nurses. However, organizations should consider investing this cost savings back into the nursing workforce. This would help to develop tuition reimbursement programs for continued education and certification. In an effort to prepare nurses for changes that may occur as a result of magnet designation, nurse leaders must be prepared to share the message of change. They must be prepared to answer difficult questions and communicate effectively how magnet designation has the potential to positively influence the nursing workforce in addition to patient care. Nurse leaders must employ all methods available to ensure they communicate effectively. This includes the use of behavior assessment tools such as the DISC assessment. This will allow the leader to recognize the areas in which they communicate effectively and the areas they need to concentrate on when communicating with the nursing workforce. Nurse leaders will also need to be aware of the behavior styles of their audience so they can adjust their message to effectively communicate with those that may have a different style than their own. While this literature search rendered results favorable for obtaining magnet designation, there were a couple areas that would benefit from continued studies. While there was evidence that magnet designation can have a positive impact on an organization's finances, more information about the specific areas that could be impacted would be beneficial. Additionally, information on strategies for combating nursing dissatisfaction while working to obtain magnet designation would help organizations learn from those that have been in similar situations. Based on the discussion of magnet designation, would you be in support of continued efforts to obtain magnet designation knowing that the nursing workforce has become dissatisfied with the process and our organization may lose qualified experienced nurses as a result?